All right, let's get into symptoms a bit. So it's basically the opposite of all the benefits, right? So we've mentioned benefits like relaxation. Okay, so the symptom or side effect of magnesium deficiency could be anxiety. It could be trouble sleeping. It could be leg cramps or restless leg. It could be blood pressure, like we just talked about. Blood pressure issues that are uncontrolled, just hypertension in general.
Yep.
What else? What else is on the bad things, the symptoms?
Yeah, I mean, tremors, vertigo, just hard time swallowing, nausea, tired, fatigue, anxiety, depression. I mean, these are all things that potentially could be there. Sleep issues, epilepsy, asthma, depression, cardiac issues, cardiac pain, PMS. I mean, I see it a lot. Women that have magnesium deficiency, a lot of women that are going into premenstrual symptoms, guess what they start to crave? They start to crave dark chocolate. Why? Because dark chocolate's very high in magnesium. So a lot of women intuitively crave dark chocolate because their body knows that there's certain nutrients in there that will actually help a lot of that cramping. So magnesium is really important for cramping, and we can actually increase it right before a woman starts to menstruate and or during and after to help relax the muscles.
Yeah, just because it's common to have PMS and cramping doesn't mean it's normal. So
Yeah.
we like to say, a woman's menstrual cycle should really just kind of sneak up on you. It should just come and all of a sudden, oh, you're bleeding. There we go. As opposed to a week of misery, irritability, anger. I mean, there's so many issues that
it should just sneak up on you. Absolutely. I want to just highlight one thing before we move on. Let's just go over the family of medications that tend to deplete magnesium. So we have the acid blocking medications, right? Your Prilosec, your Nexium, your Zantac. We already talked about the mechanism why, because we need enough acid to essentially ionize those minerals so we can absorb it. We have the blood pressure medications. We talked about that, whether it's the water pills or whether it's the beta blockers or the ACE inhibitors or the ARB medication. We talked about those.
So Lasix, a lot of people get put on Lasix, not good.
Yeah, Lasix, that's a diuretic. Digoxin's another one. That's a heart medication that will deplete magnesium. Certain hormones can as well. Birth control pills are known to, and this is another vicious cycle. So a lot of women, they're on birth control pills, maybe an antidepressant, maybe they're on an acid blocker. You can see how if you're on a combination of those medications, you are in trouble. So various hormones, whether it's estradiol or estrogen creams, the various oral contraceptives like the ethinyl estradiol, those are like a lot of the birth control pills like the Yasmin or etc. Various ethinyl estradiol compounds, ADHD medications, the methylphenidate medication. This is like Ritalin, Concerta, Metadate, Adderall, and then also various antibiotics, whether it's amoxicillin or Z-Pak, Levaquin, minocycline. These antibiotics can deplete magnesium, and then also corticosteroids. And corticosteroids have a major effect. They increase blood sugar as well. So when you increase blood sugar, that's going to also affect the metabolism of magnesium. So various corticosteroids, whether it's hydrocortisone cream or prednisone or methylprednisone, these are all going to be big ones there. And I think it's a pretty good way to start. So antacids, acid blocking, blood pressure medications, hormones, oral contraceptives, ADHD medications, antibiotics, and corticosteroids.
Yeah, let's take Johnny, who can't pay attention in school. Let's put him on ADHD medication. So now he focuses, and then he's depleted of magnesium. So now he's anxious. And now the doctor says, well, now we need to calm him down. So let's get him on a benzodiazepine to calm him down in the evening. And then we'll stimulate him in the morning with the ADHD medication.
It's like, that's crazy. I mean, you can see the vicious cycle.
Yeah, it doesn't have to happen this way. I mean, in our case, we could come in, we see something like ADHD, we could throw more magnesium in. We could throw in chlorella and detox nutrients, help the liver, help the gut. I mean, we work with so many kids that the teachers are like blown away at the progress they see. And this is all relatively simple stuff. I mean, once you get the root causes, you get the clinical data, you get the proper lab testing, you can see what the heck's going on. Then you can fix it. And you don't have to get the kids on drugs. It's just ridiculous.
Yeah, especially boys. Boys tend to have the harder time sitting, still for 6 hours as you get into grade school. So boys tend to get prescribed a lot of these medications just easier for them because they tend to have a harder time sitting still and focusing. So be careful. If you have a boy, you really got to watch out because these medications tend to be what's prescribed if they don't comply. So if you're in that kind of public school type of apparatus and your child's not conforming, you got to be careful because this is the vicious medication cycle that may be prescribed to get your kid on track.